Constipation is a big concern for parents who have gone through the issue with their toddlers and older children. Generally speaking, constipation is caused by tightening of the muscles at the end of the large intestine that make it difficult for stool to pass. Consequently, a child who notices that it's difficult or that it hurts to strain or go may hold it in, and that just makes the problem worse. The longer it sits there, the harder and the drier it becomes, and the more difficult it is to pass, and it just compounds the problem. So if you notice that your child is straining unusually hard to go to the bathroom, if they go 3 to 4 days without bowel movements, or you notice blood when they have bowel movements because of the straining and the stretching, then it would be best to talk with your pediatrician if this is a chronic issue. Another sign of chronic constipation is leakage of soft stool around the harder stool. In fact, it kind of looks like diarrhea after, a long period of constipation. So if you notice leakage on your child's diaper or underwear, call your pediatrician to get advice about it at that point. But if your child is just having an acute case of constipation, generally speaking, they're fine. They've just gone a few days since their last bowel movement, and you want to make sure that they're okay and things start moving again. Bump up their fluid intake, give them some apple and pear juice to drink, increase their fiber intake, and get them active and moving around. And usually that's enough to resolve acute cases of constipation. But again, if it turns into a chronic problem where those things aren't working, and this is happening over and over again, you're noticing that your little one is straining on a regular basis and going many days in between bowel movements, then talk with your pediatrician. They'll ask you more specific questions about your child's eating habits, hydration status, and activity level, and decide what treatment would be best. Under certain circumstances, the doctor may recommend the use of laxatives, stimulants, or enemas, but only use them if advised by your pediatrician. If you have more questions for me in the future, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.